Function with Purpose podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to season 13, episode 1 of the Function with Purpose podcast. We are back at it into the new year of 2026 coming at you. A little bit different approach and topics this year. Maybe a little bit more insight and knowledge on some things that patients should be knowledgeable about and that physical therapy can help. Along with some personal stories, of course, on top of this. But welcome. Thanks for joining in. This is Dr. Amy, season 13, episode 1. Here we go. Crystals. What? Crystals? What are you talking about, crystals? Are you talking about, kryptonite? Are you talking about Superman's crystals at the Fortress of Solitude so he can gain knowledge from his father and parents? No. But that, I guess you could relate to that. Crystals loose? Don't worry, physical therapy can help with that. Don't jump the gun too fast to reach out to a medical provider, i.e. medical doctor or doctor of osteopathy. Hear me out on this. Crystals loose, yes. We actually have these little crystals housed inside of our ears. In fact, the smallest bone in the body is located in our inner ear. I can't remember the exact one, but there's 3 little bones. Saddle, is it? Oh gosh, I'm brain farting right now. But anyhow, so these little crystals, we actually have bones inside our ear, and then we also have this inner ear balance system that's connected literally to our balance system in our brain. So this little inner ear area or canal is where these crystals are housed. And these crystals help maintain equilibrium or balance as we move in space. And sometimes, especially in the 5th, 6th, and 7th decade of life, these crystals can become dislodged. How? Dr. Amy, how do these crystals, do they physically fall out of my ear? No, they don't. But they move from where they're housed in our inner ear, in our semicircular canals. We have 3 canals. They get dislodged into one of these canals. And they're not supposed to be there. They're supposed to be free floating, and they're just supposed to kind of fall or move around like I like to create this analogy of, if you ever grew up with one of those snow globes and you shook it in the snow, you can see it fall within the snow globe. I like to think of the little snow inside of the snow globe as these crystals, right? So when we shake or move, the crystals will move around and then they'll slowly make way back down to their home. But sometimes these crystals get dislodged. They get stuck in these semicircular canals based on what we do. And for some reason, in the 5th, 6th, and 7th decade of life, it's very common for individuals to experience this. In fact, more common in women than men. I don't know exactly why, but there is a story behind this. So, crystals loose, don't worry, physical therapy can help. Physical therapy, as a physical therapist, we are certainly capable, as you know, or should know, or perhaps don't know, we are an extension of your primary care provider. Like, essentially, we can and should be direct primary care providers, because A good physical therapist or a well-practiced physical therapist gets good at the basics: assessment, examination, screening, etc., before digging into the issue that the patient is coming in with, right? So we're talking about really zoning in and honing in on previous medical history, comorbidities, etc., that all tie into the bigger picture. So women are more commonly affected with these crystals becoming loose in the inner ear. So this specific dizziness, aka vertigo, vertigo dizziness, is termed BPPV, Benign Paroxysmal Positional Vertigo, or dizziness. BPPV. So this is the most common type of vertigo cases that healthcare providers encounter. And too often, patients will unfortunately be prescribed medication because the medical provider or the provider that is assessing them doesn't do their due diligence to really fully assess the patient. So medication commonly does not help this specific individual with this specific type of dizziness, this BPPV. So throughout life, like, dizziness is not a normal thing to experience. Although sometimes, based on certain medicines that perhaps we may have to be on, dizziness can be a side effect. And then other cases, like in this episode, when crystals in our inner ear become loose, aka BPPV, aka peripheral vertigo, there's just this really sudden imbalance experience. And a physical therapist can fully assess someone very quickly if it's truly the crystals that are knocked out of place. So I'm here to talk about this specific dizziness, BPPV. So this dizziness occurs inside of our ear area, or our balance system. So our ear has this little balance system with 3 semicircular canals. And this is something that you can look up. But these canals, based on our position in space, help us kind of keep this equilibrium with our vision field and our full body balance. So when these crystals become loose, a common symptom that patients experience is dizziness that lasts typically less than 1 minute, or even less than 30 seconds. Usually this sudden onset of dizziness occurs when they change their position. For example, a common change in position is when you're laying down on your back trying to sleep, and then you roll over on one of your sides, and then you experience this rush of this dizziness or the room spinning sensation. Usually that type of symptom lasts less than 1 minute. And then it goes away. And you're like, oh, don't really think anything of it. And it keeps happening every time you go to bed, every time you lay down on your left side, or you roll from your back to your left side, you experience this sudden onset of vertigo or dizziness. And then it goes away after a minute or less. And then you try to roll to your other side and you don't experience it. And you're like, what? Like, what's going on? Something feels off. Well, that is AKA secret code for perhaps you might be experiencing these crystals becoming loose within your inner ear or your balance system. So rather than scheduling a visit with your healthcare provider, primary care physician, MD, DO, nurse practitioner, or physician's assistant, a physical therapist can totally be that call. You can pick up that phone or text your physio if you have them on speed dial and ask, hey, I'm experiencing this dizziness. This is what happens. This is what I've noticed. It usually happens when I'm sleeping and rolling over to my left side. And maybe at times when I'm picking things up off the floor and I'm turning my head to the left. Oh my gosh, I just get this sudden rush of dizziness and then it goes away after a minute. Oh, guess what? Come on in. Let's assess you. Let's make sure it is what it is. That is easily treatable. As a physical therapist, we should be able to perform a thorough, quick, concise neurological assessment to make sure that it's not these crystals loose or this BPPV vertigo. So, after a further assessment and knowing and everything else like checks out as negative, you're checking the eye movement, you're checking head movement, and then you actually get into the gold standard test for these crystals knocked out, or BPPV, Benign Paroxysmal Positional Vertigo. This gold standard test is termed Dix-Hallpike and is very easily treatable with this typical maneuver that you'll see if you Google this, called the Epley maneuver. If you know, as a physical therapist and as the patient, that when you turn your head to the left and you turn over to the left after laying on your back, that you experience this dizziness, guess what I'm going to do as a physical therapist? I'm going to test the left side. I'm going to perform the Dix-Hallpike test to the left ear. Now, I'm not going to go fully in depth with this, but if that holds true, and when the Dix-Hallpike test is performed by the physical therapist, and the patient experiences those symptoms immediately, very common, most of the time, the patient will experience and the physical therapist will visually see the patient's eyes twitch or kind of rotate very quickly. It literally looks like crazy eyes. Like the eyes are going all over the place. They can't control it. That is called nystagmus. And that's very common, commonly associated with BPPV. Now, this nystagmus, or this quick eye movement, also indicates where these crystals are dislodged in these inner ear canals, these semicircular canals. Very common for podcast purpose. Very commonly, the crystals become dislodged in the posterior canal. So very easy. So once the Dix-Hallpike test is performed, and in this case, in this example, to the left, and I visually see the patient's eyes, wobble eyes, they're going all over the place, and they're like, yeah, this is, oh my gosh, this is it. This is totally the thing. It makes me think of the snow globe analogy. The eyes are shaking very heavily, right? Fast. And then after you get done shaking the snow globe analogy and you rest it, the snow starts trickling down very easy, and then eventually it falls back to the ground. That's what I see in the eye. The eye shakes very bad, and then it starts slowing down until it becomes still. That tells me, as the physical therapist, that the crystals are starting to maneuver in that posterior canal until I move the patient again. So they're starting to calm down. In relay, the patient will tell you, oh gosh, yes, That feels better. The dizziness and the room spinning is totally gone. Okay, cool. On my command, this is what we're going to do next. You immediately, as a physical therapist, go right into the treatment maneuver, aka the Epley maneuver. So with each positioning of the patient most likely will experience this huge rush of that vertigo, dizziness, and the room spinning as you're performing, from the physical therapist, the Epley maneuver for the treatment. And again, the symptoms for BPPV based on head position and body position usually last less than 60 seconds. So that tells me we're in the right place if the patient tells me verbally, oh my gosh, here it comes again. Okay, and then it calms down. All right, we're on the right track. Then we change the patient's body position again. Oh, here it comes, but it's not as bad as the first time when we laid back. Okay, this is good. We're literally repositioning or putting those crystals back where they need to go. And then we get the patient sitting up on the edge of the bed in a specific position from the Epley maneuver, and their symptoms are pretty much gone. How wild is that? That is cool. Crystals becoming loose in our inner ear can be easily treatable and assessed by a physiotherapist or physical therapist. Almost all the time, medicine won't do anything for this. Like an oral drug that you have to take, like a pill for dizziness. It is unnecessary for this specific type of vertigo, usually. But that's where proper examination, screening, and assessment comes in from the physiotherapist. Is it truly BPPV? So again, with this specific type of vertigo, your crystals feel loose. Usually, as the patient, you'll experience this type of vertigo. It's very specific. It's usually turning over in bed, or it's usually getting up out of the bed and you're sitting up on the edge of the bed or something, or a sudden change in movement of your head. And the dizziness usually lasts less than 1 minute. Also, that sensation or that nystagmus, where the eyes kind of move super crazy, is very common as well, right? So that sensation when you're staring at something and you feel like the room is spinning, but again, that spinning sensation is usually experienced as the patient less than 60 seconds. So a physical therapist or seeing a physical therapist can help you put these crystals back in place. You don't need to go seek an actual you don't need to seek actual emergency room thing unless there's other stuff going on. But in this case, in this specific talk, I'm talking just basic examination that it's truly the crystals that are loose or the patient is experiencing BPPV. So what happens after I get this treatment? How many times do I have to come back? Do I have to do this forever? Glad you asked. Well, there is some homework that the patient should abide by. Usually after the first visit, going into that night, and then maybe a couple consecutive days, maybe 3 or 4 days, I highly advise the patient sleeping in an upright position or in a recliner or on a wedge where they're propped up in bed, because I don't want them laying down again. I don't want them laying down and dislodging those crystals again back into that posterior canal of the inner ear, right? We have to break the habit of that quick turnover in bed, because if you instill that night without even thinking about it, you just unwound what we tried to fix. So you're keeping it there, right? So first and foremost, the number one homework is being in an upright position when you're sleeping. So a recliner, or you have several pillows propped underneath your back and head where you're trying to sleep on your back, to be honest. It sucks, but you know what? It's better than experiencing this dizziness. Another piece of homework is, avoiding sudden head movements or sudden changes of position. So being a little bit more methodical and a little bit more aware of your daily routine, and even if you happen to be talking on the phone and you're tilting your head to one side, use the speakerphone. All these little activities of daily living or little routine habits that were unnoticed before need to be noticed for the next several days. So avoiding sudden head movements. Also, I highly advise caution with driving. That's going to be patient dependent and how comfortable they feel, but I always caution avoid driving anywhere for the next day or two. So hopefully you won't have really a lot of errands to do. It's just, when you're driving a car, you want to be safe and you don't want to do those sudden head movements in order to safely drive a car. So if we can, let's try to avoid driving for the next couple days. One thing I do promote is exercise. Well, holy cow, Amy, like what? Like exercise? What? I just, I might have to bend. I might have to do this. Well, guess what? Modify. If a workout, or if you want to perform deadlifts, i.e. bending forward and picking something up off the floor, well, guess what? Bring the floor up to you. Put the weight on a 20-inch box, and you're doing mini bendovers, but it's controlled. I highly, highly promote exercise. Cardiovascular, maybe you're riding an upright stationary bike, right? I like the bike because it is stationary, right? I prefer not the rower as much. Definitely not like a ski erg where you are bending, but I would say stationary bike one, walking safely on a treadmill or a manual propelled treadmill, and the rower, but keeping the eyes on a target type deal. So still avoiding head movements and sudden changes in body position, but exercise for sure, right? I want to get the heart pumping. I just don't want you to just sit there in a recliner all day and just watch Netflix and chill, right? I want you to move. So those are kind of like the basic pieces of homework that I'll give patients. And, not only that, but monitoring their vertigo symptoms, right? How intense are they? Are they even there at all? Is the sensation of the room still spinning when you, forget that, I can't turn my head to the left as fast. So those are all things that you monitor. You got to monitor your signs and symptoms, right? What you experience. So usually from a physiotherapy perspective, after we do one treatment, I like to follow up a couple days after if the patient can come in, or the next day. My funny story, my mom actually had this maybe 3 times, and we figured out why she kept experiencing this BPPV. Well, and I was treating her every day, and I'm like, dang, your symptoms are still there. They're lingering. Or we completely abolished her symptoms, and then a month later, here it comes again. And I'm like, what is going on? So I go, show me how you get in the bed. She literally was tossing herself. She would sit on the edge of the bed and she would throw her upper body towards the right in order to swing her legs up towards the right in the bed. And she was literally dislodging her crystals on the right side every time she would kind of throw herself up on her right side. So guess what? We found out it was her habit of getting in the bed that was causing the vertigo. So since then, nothing has happened. Maybe it's that. Maybe it's if you, for some reason, keep experiencing this positional vertigo, maybe it's how you actually get in the bed or how you pick something up and you're constantly reaching maybe towards the left. So you got to really fully assess how you move throughout the day. And it was just so funny when I was like, Mom, she sat up on the edge of her bed. I was like, you are literally doing this to yourself. And she was laughing. But I'm just glad that we were able to, cease this, abolish that vertigo. And she feels great. She's fine, right? So crystals loose, or do you experience when you suddenly change head positions or body positions that you experience this dizziness or vertigo or the sensation of the room spinning and it lasts less than 60 seconds and then you're able to do your daily routine, but then it's pretty consistent every time you go to bed or, every time you perform a specific movement and you're thinking about, oh my gosh, I think I need to go to a neuro doctor. Hold the brakes, pump the brakes here. Let's see, maybe try reaching out to a physiotherapist first, have them fully assess you, make sure that it's not something serious before you go on to a full-blown medical, neurologist assessment, right? Because when it comes down to it, I'm going to vouch for it. Physiotherapy is direct primary care. Physiotherapy can be your first direct point of contact. And as a physical therapist, we spend the most time with our patients. We need to fully assess the patient in front of us. And when crystals become loose, it's very easily treatable. So, if this sounds like you, maybe search for a local physiotherapist in the neighborhood. And we should have someone in our phone book to reach out to, just like you do with your primary care physician, right? So, thanks for hanging in there. If your crystals are loose, don't go take some medicine first from a prescription written from a medical provider. Let's make sure that it is what it is and it's nothing too serious. So physiotherapy can totally help with this, and it's easily treatable, easily manageable, and it just might help you, realize that some of your daily habits could be contributing to the crystals in your inner ear being dislodged, and not physically dislodged, but misplaced in your. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.